Good evening, everybody. It is 6 p.m. and we're going to get started and welcome everybody to our first ever open enrollment seminar. Obviously, with COVID, we have learned new ways to communicate with our members. And so we have put together an open enrollment seminar this evening to provide you knowledge about benefits and the process on getting you enrolled or the process that you would need to make any changes. On behalf of UFCW 135, 324, 770, 1167, and 1428, we thank you for joining us tonight. As you know, the packages for open enrollment were mailed out starting on November 2nd, so everybody at this point should have received their packages. On tonight's call, we will have, thank you, Daniel, for holding up your package. On this call, on tonight's webinar, we will have staffers from the Southern California Food Trust Fund who will be presenting. We also have staff from our local unions. From 1428, we have Diane Zuniga, Kathy Moreno. There's also union reps on here from different locals, and there's also union trustees. We have Kathy Finn from 770. We have Matt Bruno from 1167. And I believe I thought I might have saw John Grant, President John Grant from 770 joining us. We will also have presenters from Anthem and Kaiser later in the program. And with that, I welcome everybody, and I'm going to pass it on to Maggie Claudio, manager from the Trust Fund.
Good evening, everyone. Thank you, Deliana. My name is Maggie Claudio, and I'm the manager of the Audit, Recovery, and Appeals Department at the Trust Fund. I want to thank you all for joining us today. I know that your time is valuable, and we appreciate that you chose to spend it here with us tonight to talk about open enrollment. We've assembled a group of experts to share information and answer all of your questions. As Deliana said, you're going to hear from the Trust Fund, Anthem, and Kaiser. By the end of our presentations, it's our hope that you have received enough information to help you make the best choice for you and your family. As you listen to these presentations, I know that questions will arise, and I ask that you hold all questions till the end. We've dedicated some time for question and answer, and we'll be utilizing the chat function for that. For those of you who are calling in, the Trust Fund will be posting their presentation on our website shortly after this meeting. Joining me from the Trust Fund, I have the Operations Department, Manager Dina Lewis, and Assistant Manager Karina Zavala. We also have our Claims Department Manager Eileen McNeese and Assistant Manager Blanca Gutierrez. So with that, again, thank you for joining us, and I'm going to send it off to Dina.
Thank you, Maggie. I think we've got the open enrollment slide deck coming up. There we go. So we're currently in our open enrollment period, which is generally through November and December for effective January 1st of the next year. Today, we'll take a look at steps to enroll, how you can submit your enrollment. We'll also take a look at our My Portal site where you can enroll through our website. You may have seen the poster on the left in your store break rooms. There's a QR code at the bottom right of the poster that will take you to the enrollment portal. And along with that, there's an email that the fund had sent regarding open enrollment. There's a link in that email that will also take you to the My Portal site. And Karina will go over some of the My Portal benefits a little later in the presentation. The open enrollment deadline is December 31st. So if you have any changes to make or you do want to enroll, you want to make sure to submit your paper enrollment form or go to the My Portal site and submit your enrollment form through the portal. If you don't have any changes to the benefits that you're currently enrolled in or any dependent changes, you don't need to submit an enrollment form. your benefits will continue as is. Okay, here are a couple of options in how to submit your enrollment form. Um, we have a My Portal site that's available either through the fund's public website, or you can go directly to the My Portal site. You can also upload supporting documents if you're adding a spouse or domestic partner or dependent. You can submit your documents, your marriage certificate, birth certificate can also be submitted with your enrollment form. You'll also need that if you are submitting a paper enrollment form. You can submit paper enrollment forms through mail to the fund office or your union local. You can email them to the fund through the contact email address on the screen. We also offer curbside drop-off at the fund office and in-person appointment also at the fund office. That's available. You can make those appointments through your My Portal site. Plan A employers are Albertsons, the bigger stores, Albertsons, Gelson's, Ralph's, Vaughn's, Stater Brothers. Plan B employers, Food for Less, Rancho Federal Credit Union, Bridgeford. That will be part of the determination of your weekly premiums. Plan A's classifications by whatever your job your job classification is, whether it's courtesy clerk, helper, clerk, mead, or pharmacist. And then your coverage levels will be determined by the months that you've worked. So we have silver, gold, platinum, and then platinum plus are for those who were hired before 2004. Okay, and the same with Plan B benefit level. Weekly premiums, participants are required to pay a share of cost for coverage through weekly payroll deductions. The standard weekly contribution to premiums start at $8 per week for Plan A participants. And for Plan B participants, they start at $7 per week for single coverage. The premiums do include all of the benefits you're enrolled in through the medical plan and also in the dental plan. And we'll go over that, some of the benefits in a couple of slides. The medical plan options that are available for all participants is the indemnity PPO with Anthem Blue Cross. We also offer Kaiser HMO to the Platinum and Platinum Plus groups, and then Anthem HMO through Anthem available to our Platinum Plus participants. Mental health benefits are included in your medical plan through HMC HealthWorks, unless you're enrolled in Kaiser. I'm sorry, there's a little background noise here. If you're enrolled in Kaiser, those mental health benefits are available through your Kaiser plan. Your medical plan does include prescription coverage that's provided by Caremark for all plans. Prescriptions can be filled through participating retail pharmacies, which you can find through the Caremark website or your Caremark app to locate a network pharmacy. Also, the pharmacies that are in our grocery stores, Albertsons, Vaughn's, Pavilions, Ralph's, Gelson's, Rite Aid, and select CVS locations. The medical plan also includes ancillary benefits, podiatry through dental, through the PPOC plan, and vision benefits. Again, that's also included in the weekly premium rate. We also offer dental. Dental, you may choose to enroll in the indemnity dental plan. And then we offer prepaid dental plans with the offices shown here. And then in the indemnity dental, here are the annual deductibles and annual maximums for the dental plan. And this is indemnity dental. 50% of the unused annual maximum can be, from the prior year, can be rolled over into the next year. Okay, and then I pass it off to Karina Zavala. She'll review some of the benefits of using the portal.
Thank you, Dina. So you can go ahead and access your portal through our main website or through scufcwfunds.com/portal. If you are new to the portal and you do not have an account already, you will need to create an account. You would simply select create an account. You would then be required to complete all the fields here. You would include you as a participant, your first name, your last name. You would provide an email address, the email address that you prefer we send messages to, confirm the email address, list the last 4 digits of your social security, your date of birth, a type of phone and phone number that you would like us to have on file. Now, if your name and birth date don't match what we have on file at the fund, sometimes when you go to create an account, it will go ahead and flag you with an error. You can go ahead and contact the fund office, and we will go ahead and cover what we have on file with you. So you can then go ahead and create an account with us. So once you create the account, it will send you a confirmation email to the email you provided. So once you receive that username or you created a username and password, you can simply hit login to log into my portal.
It's stupid.
Then you would be on the dashboard is the first thing that once you log into your portal, you will see the dashboard. So it should show your name right up at the top here, and then your fund ID. And then here's the appointments Dina was talking about. You can go ahead and schedule virtual or in-person appointments. You would simply hit schedule now. It will provide you with your enrollment status, so you can go ahead and check your status. It'll show you what you're currently enrolled in. There is a list of key documents. This portal is personalized to your plan and your plan options if you're an A or a B. So the key documents may look a little bit different once you log into your own actual portal. If you wanted to make any changes to your address, phone numbers, or email on file, you can go ahead and do so anytime on the edit profile. You don't have to submit an enrollment form if you're just making a change for address and you're not making any other plan changes. So you could simply log into your portal, go ahead and hit edit the profile, and then you could update any of your personal information. Back here at the top, you will see your open enrollment banner, and it's a purple open enrollment banner. You can simply click on it and it'll take you over to your enrollment options. If you don't see that banner when you log in, do go ahead and contact the fund so we can provide you with your enrollment options if open enrollment is not an option for you yet. So once you hit the banner, you'll see your current enrollment options. It'll show you what your plan is and then what your medical options are to enroll in. It'll give you your dental options. And if you're able to enroll a spouse, domestic partner, or dependent children, you would see them under the ability to enroll. In this case, this user already has an application on file, so it's asking them to check the application status. For those of you that are enrolling for the first time or you're newly enrolling, you want to look for this button, the new enrollment application. You would simply hit the button and then you can go ahead and start your application, submit it on your portal, and then you're done. So that was a summary of what you will find on my portal. So I hope that was useful. There's actually a lot of information. And again, if you have any trouble logging in, just go ahead and contact the fund office. We are open from 8 to 5. And with that, I will go ahead and hand it over to our claims manager, Eileen.
Hi, I'm Eileen. We're going to go over the HRA benefit. If we get to that slide, so just bear with us a second. There you go. So our indemnity PPO plan has a $1,000 deductible for all of our different plans. All of your plans are based upon your job classification, your length of time or length of service, as well as your family dynamic or your choices. So everybody has a $1,000 deductible. Depending upon your plan, you either have an 80-20 plan or a 75-25 plan. There are also out-of-pocket maximums that range from $1,500 to $2,500. Again, if you log on to the portal, it'll give you your specifics for your particular plan coverage level. You can go to the next slide, Rena. To help offset the deductible, which we acknowledge that sounds kind of high, we have an HRA benefit, which is the health reimbursement account. The health reimbursement account is to help you earn money to help offset your deductible and coinsurance amounts under the plan. The more activities you do, the more you can earn to help fund that account to help offset your deductible and coinsurance. Participants and covered spouses and domestic partners can help earn HRA funds by completing healthy activities. Children are not eligible to earn HRA dollars, but the entire family can benefit by using the funds. No additional paperwork is needed to be submitted to utilize these funds, as they are automatically applied to eligible claims processed by the fund. And funds are applied in the order the claims are processed. The normal plan activity year is June 1st through May 31st for the following funding year, which begins on January 1. However, for those who are newly eligible, either they're switching from the HMO to the PPO plan for the first time effective January 1, or they're newly eligible to the PPO plan for the first time ever, January 1, you will receive the one-time full benefit of the HRA, which is the base amount plus the activities. You do not need to do anything the first 6 months for this cover or for the HRA benefit. However, on June 1st, you can start doing activities that will provide funds for the 2023 year. So the normal process is that you start doing activities June 1st through May 31st of the following year, but it gives you benefits the following January 1. So the activity year is June 1st through May 31st. And once you're enrolled, future years will see that base funding occurs every January 1. The base funding amounts range from $150 to $500 based upon your plan level and your family composition. Additional funding can be earned by both the participant and the covered spouse or domestic partner by completing different healthy activities, such as you can register for the fund's web portal. That's a one-time funding, as you can only register once. But additionally, you can submit a contact information form for both you and your spouse or covered domestic partner, and you can do that every funding year. You can also do a health risk questionnaire or an HRQ. This can be completed online or by phone through HMC. You can watch a health benefits video, which is a short 15 to 20-minute video that explains the HRA benefits and how your plan works. So it's very informational. I would recommend that everybody do it at least once to get a basis for how the plan works. You can also receive an annual physical. Both you and your spouse can do this. We have additional preventive health services such as a colonoscopy, a COVID and or flu vaccine, pap smear and mammograms for females, and a PSA test for males. There's no limit on the number of healthy activities you can do up to the annual maximum funding available. We also have something called healthy lifestyle activities, and you can do up to 2 of these. Either you or your spouse participate in a weight management program for 3 consecutive months within the funding year, complete a tobacco cessation program, join a gym or fitness center or other physical activity club or class for at least a 3-month membership, participate in a 5K or longer run, walk, bike event. During the pandemic, we do recognize virtual events as well. So you can submit the paperwork showing that you've been enrolled in any of these events. All of the additional details and necessary forms and the website links are all available on the fund website. Some of these activities you can simply do by logging onto different website links, and some of them do require that you submit paperwork and documentation. Any of the healthy activities that you do, such as your physical, your colonoscopy, pap smear, mammogram, those, if the fund processes those claims and pays for those claims, you don't need to submit anything. We will automatically generate that funding for that activity when we pay the claim. There is a total annual maximum funding available. And again, it's based upon your plan level and your family composition. You can get for your specific plan what that maximum is on the website in your portal. You also have the option to opt into using your HRA funds to reimburse your prescription copays. You can opt in, there's a form on our website that you can opt in for, or you can opt out if once you're in it, you don't want to do it any longer, you can opt out at any time. HRA funds cannot be used for dental, orthodontic, or vision claims. It's the main goal is to help offset that deductible and co-insurance for you and your family. We would recommend that you visit the fund website for the complete guidelines of this program. And this on the screen right now is the contact us. This is important phone numbers for the fund as well as your local union office. We also have the email for where you can email your enrollment form, which is contact@scufcwfunds.com. That's a general email box. We also have specific emails for the dental or medical claims department. So that would be medicalinfo@scufcwfunds.com and dentalinfo@scufcwfunds.com. You can screenshot this, or this entire presentation will be available on our website within the next few days. And I'm going to pass it over to our Anthem representative, Tyler Clark. Tyler, are you there?
He's on mute.
I am here, and I was
Thank you.
coming off of mute. Sorry. And I'm trying to share the screen. Can you guys see it?
Yes.
Yes.
Okay, great. Thank you so much, Eileen. And thank you guys for joining us tonight. My name is Tyler Clark. I'm an account executive with Anthem Blue Cross, and we offer 2 medical plans through the union and the fund. We are the account team. Actually, I'm joined by Steve Hirado, who is the account manager, and we are the account team that work with the trust fund and the union locals just to ensure that you guys get the care you need, handle any issues or problems you may have, and that kind of thing. So first of all, we'll start with some of our member tools and resources, and in a minute here, I'm going to have Steve go through a few slides that will show you how to access these resources. The first one being our website, which offers you a lot of capabilities as far as building an account, looking at claims, ID cards, that kind of thing. It'll also allow you to find a doctor. Sorry about that. It'll help you, access Doc Finder, Provider Finder. We're going to go through a few steps on how you can look that up and make sure you're accessing the right doctor and the right network. We do also offer a telehealth portal, which is called Live Health Online. Those are virtual doctor visits that are actually, it's really handy. It comes in if you need urgent care, or instead of, and you're not able to go to the doctor, that type of thing. We also have what we call our Anthem Sydney mobile app. This is an app where you can also look up benefits, claims, electronic ID cards, and some other things. So like the trust fund had mentioned, we offer the Anthem PPO plan. The benefits in that plan, where you can find more information on the website and also in your open enrollment material, but benefits as far as deductibles, co-insurance, out-of-pocket max, those are all determined by the fund. The good thing about the benefits that they do provide, I can tell you they're extremely rich. The benefits as far as like preventative care, for example, 100% coverage for preventative care services when you use a network provider. You also have access to comprehensive coverage for in-network office visits, specialists, urgent care, hospital, outpatient services, etc. One of the nice benefits of a PPO plan is you have the freedom to choose the healthcare providers you want. If you choose a in-network provider or hospital or other provider, you will have the lowest possible out-of-pocket expenses. So like a lot of things in life, the PPO plan provides you guys with more options. With those additional options, though, however, your member cost share may be a little bit more. So it's really important that you make sure you're accessing an in-network provider. One of the things that we do is we contract with providers throughout Southern California. Well, but for example, here, Southern California, we contract with the medical groups and providers. Some of the more prominent ones being, UCLA, Cedars-Sinai, Healthcare Partners, Hoag Medical Group, that kind of thing. One of the things that I would like to point out is the Anthem PPO network that you will have access to is called our Prudent Buyer PPO network. This is our largest network. So when you go on to look for a doctor or provider, it's important to make sure you're accessing or looking up providers within that network. We'll go through that a little bit later. Just to kind of give you an idea, the Prudent Buyer network in California has roughly 43,000 providers, 30,000 primary care physicians, 23,000 specialists, and 242 hospitals that we are contracted with. Moving along here, I'll talk a little bit about our HMO plans. So Anthem offers 2 HMO plans through the fund. One comes with a $25 copayment, the other one with a $35 copayment. And the real easy way to determine what the difference is there is they're associated with different networks. So the $25 copayment plan is our Select HMO network. That is slightly smaller than our full network, which is called California Care. So you can see with California Care, you have our broadest HMO network. It comes with a slightly higher copayment, but that gives you access to our entire network of providers as far as the HMO is concerned in California. Just to give you an idea, California Care HMO network has 37,000 providers, where the Select HMO network has 25,000. So it's a slightly narrower network. You get a slightly lower copayment, but it still provides plenty of access for you and your family members to access care. So one of the things also that is offered through the fund is what we call a California Care HMO network limited access. This does not mean it's our full network with a limited access to providers. What it means is there's an exception made for members that may reside outside of the Select HMO network area. So make sure that nobody's penalized for that. We allow those participants to access a California Care HMO primary care physician and still get the $25 copayment. So going a little bit further down to this bottom section, we'll talk a little bit about Anthem HMO primary care physician changes. One of the things, for those that aren't familiar with an HMO, you will have an assigned PCP or medical group, and you will access all of your care through that provider. That provider then will direct your care if you need to see a specialist or any other kind of services that they can't render. They will then refer you within that network. It's very important that you access care through that PCP. It does not mean, though, that you are somewhat tied to that primary care physician for the duration of the year, for example. One of the biggest misnomers we see is members wait till open enrollment to try to change their doctor. And that's not necessary. You can change your doctor throughout the year by contacting Anthem. You can do that through either our customer service number, which is on the back of your ID card, or you can go on to the website. One of the things that it's important to note is verify the Anthem network that your primary care physician is a part of if you're making a change. I'll get into a little bit down here at the bottom, but you can't change from network to network as far as the select to the California care without going through the trust fund, and those changes need to be done in open enrollment. So one of the key things to keep in mind is the 15th of each month is the cutoff for any changes to take effect the first of the following month. So I've listed a little example here below, which kind of gives you an idea. Just to take today's date, for example, if I was to call and make a request to change a PCP today, it would be effective January 1st. If I waited until after the 15th of the month, it has to go to the first of the following month. So once again, important thing to keep in mind as far as your PCPs are concerned. If any changes must be made within your current HMO network. Any PCP changes that require an HMO network change must be reviewed and approved by the trust fund office. And network changes from Select to California Care, for example, can only be made during open enrollment. So hopefully I didn't do too much to confuse you guys. But what I'm going to do now is actually just throw it over to Steve Hirado. He's my account manager, and he's going to go through a few of these resources that will also be made available after the call. So Steve, go ahead and take it away.
Can everybody hear me now? Okay. Hold on just a second. Okay, and thanks, Tyler. And thank you all for joining us this evening. My name is Steve Hirado with Anthem Blue Cross, and I will be going over some tools that are available to you as an Anthem plan member. And first, we'll go over anthem.com. So anthem.com can be accessed by typing anthem.com in your computer browser. And once you receive your ID card and register on anthem.com, you'll have access to your benefits and finding contracted Anthem doctors that participate in your network. In addition, you will have access to view and print your ID cards. You'll also get access to links for health resources such as diabetes management, help with pregnancy, and other health-related topics. You will also have access to health-related discounts, such as discounts for Jenny Craig, gym memberships, and fitness-related equipment and coaching. As an HMO member, you'll also be able to request a primary care physician change using the anthem.com website. And if we could just move to the next slide. Now I'll just go over finding a doctor. Finding a doctor on anthem.com is fairly simple. By clicking on the Find Care button on anthem.com at the top right-hand corner of the homepage, you can enter your ID number or the alpha prefix, which is the first 3 alpha characters on your member ID card. This will link you to your correct provider network so you know you will be receiving the maximum benefits that your plan provides. Once you access your correct network, you'll be able to find a primary doctor, specialists, and all contracted providers by searching the city or zip code that you specify. Okay, and if we can move on to Live Health Online. We also have a service called Live Health Online. Live Health Online allows you to have a video visit with a Live Health Online provider 24 hours a day, 7 days a week. And you can access Live Health Online by going to livehealthonline.com on any connected connected device that has video capability, such as a computer, a tablet, or even a cell phone. Use Live Health Online if you have pink eye, a cold or flu, fever, rashes, or any other common conditions. It's faster, easier, and more convenient than a visit to an urgent care center. And once you log in and register, you'll be able to see available physicians along with all of their credentials. Once you make a choice, the doctor will appear on your device and you can have a face-to-face doctor consultation. A nice feature to Live Health Online is once you initially register, you will always be registered. So whenever you need services again, all you have to do is log on. Okay, if we could go on to the Sydney app. So the Sydney app is an app that was developed by Anthem for its members. It incorporates all of the tools that we have talked about today in one app. You would go ahead and download the Sydney app from your app store. And then once you register, you'll be able to view your ID card and be automatically linked to contracted providers. So finding a doctor is easy on the app. In addition, you will have all of the benefits and claims information that is available on anthem.com. A nice feature to having the ID card on your phone is that you can share it with your provider by email if they need a copy of your ID card. This is nice if you have a dependent as well on the plan who doesn't have their ID card on them. So that was a brief review of the tools that are available with Anthem when you enroll on an Anthem-sponsored plan. So now I'll go ahead and turn it over to Victoria with Kaiser.
Thank you, Steve. Let me get the presentation up. If I could find it easy enough. There we go. See? Can you guys see the screen, open enrollment from Kaiser? Yes? Beautiful. Yes. Hello, everyone, and congratulations to you all on this opportunity to upgrade your benefit plan. I want to introduce myself. I'm Vicki Cavarles. I'm the Executive Account Manager on the SoCal UFCW Food Trust Fund. I've worked in the labor movement for over 20 years before I transitioned into my current role within Kaiser, working closely with your elected leaders in ensuring that your benefit plans remain the same, or at least we can enhance them and make them better. But before I get started, let me just turn to my team so they can introduce themselves. Go ahead, Colleen.
Good evening, everybody. My name is Colleen Cole. I'm the Associate Account Manager on the UFCW account with Vicki, taking care of your needs. Looking forward to working with all of you. Thank you.
Arturo, are you on?
Good afternoon. Okay. Yes. Good afternoon, everybody. My name is Arturo Diaz, and I am the field service representative. I'm a boots on ground that support Vicki and Colleen.
Thank you. He's so humble. He's our field service rep and enrollment specialist on the ground. So here we go. Let me get this on the presentation mode. All right, so why choose Kaiser? You know, Kaiser has always had its roots within the labor movement, even before World War II. Fast forward, that history with the labor movement continues on. And UFCW is one of the unions within the Alliance of Healthcare Unions. And under that umbrella, they continue to work together to ensure that we provide a delivery system that builds care and coverage centered around you. And what do we mean by that? Care that's centered around you so that we ensure that you can get the care conveniently and access care wherever you are, whenever you want, and wherever you want to access your care. The system that we built centers around an electronic medical record along with an integrated system so that you're able to use care whether you're traveling on vacation or if you need to get care when you're son or daughter are out at college and need urgent care services, you can access care at any time, anywhere. It's a one-stop shopping network. And you have access to the entire network. If you're in Southern California, you can access care in Orange County or in San Diego, even though you're a 770 member in the LA County area. And again, if you have emergency services, that kind of care is also offered to you when you need. Now, one thing we did learn about the pandemic last year is that we had to pivot very quickly to enhance and expand our telehealth services. But most importantly, we also saw a rise around mental health services. So if mental health services is one of those things that has become an issue for you or become a need for you to address either with your child, your partner, or for yourself, take heart and know that we have a plethora of services around mental health, and you can learn more at this kp.org/mental health website. We've gone from 19% face-to-face mental health visits to now 99% of the visits and services being done online via video or telephone. And it's just as effective, and it has enabled parents with small children who have had to deal with this pandemic, and services are improving every day, and we're able to provide you even more services through different applications like our Calm, as well as our My Strength apps. But before we go into the different services, we want to get to the brass tacks of what the HMO coverage is for you all. So here you go, Colleen.
Thank you, Vicki. So this is just a brief overview of the current benefits that are offered to the UFCW employees. So you've got your preventative care at a zero copay. Your doctor's office visits for your primary care would be $25. If you need a specialty, which could be now it flew out of my head. But their specialty is $35. I'll think of that one when it comes back. Your lab test, zero copay. Outpatient surgery, $150 copay. Hospitalization is a $500 per admit. And then your emergency room copay is $100. When it comes to pharmacy, your prescriptions are through the PBM network. What you need to do is to get your written prescription from your Kaiser doctor and then take it to your PBM. You can also have it set up to where they can send it directly over to that particular pharmacy that you want to work with. Next slide. And we want to make transition very easy when you come aboard with Kaiser. So if you're looking for a doctor, kp.org, it has everything. It houses so many different things that you can look up and research, but you can look at your doctors. You can see their schooling they had. It's all there at kp.org. So please take advantage of that. And a lot of other information is there available for you. Next slide. Next slide, Vicki.
I'm trying. There we go.
There we go. Okay. So what you'll find is as you transition on, several things will be coming your way. I mean, again, kp.org is there 24/7 for you to go into. It's got an abundance of information there for you. You'll be getting your ID card. You're receiving your welcome book and a call. And when it comes to a physician, if you don't register a physician at your time when you enroll, one will be assigned to you, but that doesn't mean you're locked into that physician. If you go to your first visit, you feel there's no connection with that doctor, you're not locked into that doctor. You can go in, switch doctors at your next appointment until you find a doctor you're comfortable with. So you are, again, not locked in. We want you to be happy with your physician, have that relationship, because this person is going to work with you to take the best care for you. And next slide.
Thanks.
And here, if all the information we've got, again, a lot of avenues, but what we have set up is Arturo Diaz is our field service representative, as we introduced him earlier. You can directly reach out to Arturo with additional questions after this presentation and until you've completed your enrollment and made your decision. He's there, he's available, take advantage, ask him. He's an expert. He's been out and done open enrollment meetings at the locals. So please take advantage and reach out if you have any questions.
Yeah,
Thank
and
you so
don't
much.
hesitate. Yeah, and don't hesitate to call myself or Colleen if it gets real complicated. And like Colleen said, once you get to that point where you've made your decision and you have health issues that you want to address and want to know the best way of transitioning your records, give us a ring so that we can help onboard you and make sure that you get that seamless transition into Kaiser, okay? So what we have here are the helpful links that is under construction specifically for the trust fund. It's a portal that you'll be able to click to and at least get to see how the landing page looks like on kp.org. But Arturo has worked very closely with 1428, 1167, and 135. So if you're a rank and file member of any of those three unions, there is a microsite link. Take your smartphone, click on this picture, and it'll take you directly to their landing page. It has health topics. It has various information related to the Food Trust Fund, and it routes you back to the trust fund if you need to, process your application. For Local 770, you can visit the www.kp.org. We are going to work with them as well to get them a QR link for their website. And then last but not least is, of course, the kp.org/easy switch to address any other questions you might have before you have to make the decision. But that's pretty much it. We wanted to show you where we are in Southern California. Keep in mind that even though you live in San Diego, you're not restricted to San Diego. If you have an emergency and you're at Local 770 for a stewards meeting, any one of our hospitals will be able to pull up your medical record, be able to pull up and see what diagnoses you might have. So there is no missteps in trying to diagnose you if you have an emergency elsewhere. And that's one real good convenience, is that you don't have to carry your files around. And you know that within our system, anywhere in Kaiser, even if it's in Washington, D.C., your records will be able to be accessed by a primary care or a specialty doctor. Again, one-stop shopping makes it convenient, but you're not anchored in Southern California. And then these are some updates of what's to come in the near future, things that have now opened in Playa Vista, Claremont, and Hesperia, and things that will be opening real soon, specifically in Watts in 2023. And what's not captured here is a partnership we're doing with Providence in San Bernardino, the Apple Valley area. We will be opening a new hospital. It's under Providence, however, in 2026, but at least it will address the needs of the San Bernardino rank and file members that live in that area. And we want to say thank you. Thank you for being interested within your local union and your benefits. And I hope you have questions for us, and thank you for your time.
Thank you so much, Vicki. Before we go to Q&A, Kathy Finn, one of the trustees, would like to say a few words.
Oh, hi, everybody. I thought I was going to say something after the Q&A, but anyway, I just wanted to say appreciate everybody coming on to hear these presentations, and I really hope that it's been beneficial to folks. And of course, the most important thing is if you have questions, there's always folks available to help, both at the trust funds and at all your local union offices. We have knowledgeable people who can help answer all your questions. So if you have questions, give us a call.
Thank you so much, Kathy. We'll go to our first question. And the first question is, if they did not receive the packet, the open enrollment packet, what is your recommendation on how to proceed on signing up?
This is Dina at the Trust Fund. If you have the option to go online, your My Portal site would allow you to enroll for open enrollment. Otherwise, if you want to contact the office, the trust fund office, we can mail a packet to you. It could be that we don't, for some newly eligible participants, we may not have your address on file. So if you haven't received an open enrollment packet, please contact either the fund office or your union local.
Yeah, and this is Kathy again, sorry. I would also just suggest if you can go to your local union office, because you can fill out the paperwork right there and make sure it gets submitted, and you can get it stamped and everything, so you can have proof that it was submitted, because sometimes if you wait till the end and you put it in the mail or whatever, it doesn't get received, or you don't wait for your packet to come, because we got a lot of people, they wait and wait and wait, and then it ends up being too late. So I would suggest go to your local union office. Folks there will help you fill it out correctly, so you don't have a problem.
Thank you. Next question is a courtesy clerk eligible for the family plan?
Courtesy clerks are eligible for single coverage or employee child coverage. They are not eligible for the family plan.
In order to get the family plan, they must be a GM, general merchandise clerk, or a food clerk, correct?
Correct. And after 24 months of employment.
Thank you. Another question is, somebody's been with the company 42 months. They want to know about, when are they eligible for the benefit upgrade? And do they need to do anything to get that upgrade?
If they're already enrolled, you don't need to do anything for the benefit upgrade. But if you have questions regarding other plans that might be available to you, it would be best to contact the fund office or your union local.
Somebody will become eligible in February. They were just concerned that since it's open enrollment, that they would not be able to sign up in February. Can you just go over it when people become eligible for the first time?
Once you become eligible, a packet will generate for your eligibility. It would indicate when you're eligible to enroll. And the portal usually opens up about 3 months prior to your initial eligibility date. So you can go onto the portal. You don't have to wait for to receive your packet, or you can contact either the fund or your local to submit a paper enrollment form.
Another request is, can somebody put on the screen the address to the portal so that they can take a snapshot and the phone numbers for the locals and the trust fund?
I think we have that available. You can also, it should also be available in your packet, that information, but it's, let me go ahead and read it off to you while we find the slide. It's
I'll share it.
SC, okay, it's scufcwfunds.com and then /portal.
Can you see the screen, the contact us field?
Yes, so I recommend everybody to go ahead and take a photo of that with your cell phone so that you have the details available after this seminar. Another participant is a silver plan. When could they choose Kaiser as an option?
Kaiser would be available when you become a platinum participant. That's usually around, I think it's year 6 or 7, but it's probably best to contact the fund office and we can give you the date to anticipate that upgrade.
We have somebody that's retired but working. Do they need to enroll in another medical plan, or can they keep Kaiser what they currently have as a retiree, a working retiree?
That one we'd have to look at also. It's best if we address that personally, directly with that participant.
Okay. The next question is, they're asking for a coworker who just started. They want to know when they would be eligible for signing up for medical benefits as a brand new employee.
Again, it would be best to contact the fund office or your union local. We want to look at when the first hours are reported and the job classification.
So
Can you just generally say like a courtesy clerk becomes eligible after generally after 18 months, and everyone else generally becomes available at about 6 months, just so people have kind of a general understanding.
Yes, that's correct. So clerks and pharmacists around the 6th or 7th month, and then courtesy clerks, utility clerks, helpers at 19 months.
And if you get promoted from a courtesy clerk or utility clerk, you would jump into 6 months. So that, like Deanne said, it would be the 7th month that you'd be eligible if you got that promotion. I'm going to be promoted soon. How soon can I add my domestic partner? So if somebody gets promoted, how long does it take for you get to the trust fund to get information to give them the open enrollment package?
If you've already reached the 24-month mark, you might be able to enroll a newly eligible domestic partner the first of the following month, depending on the life event or at open enrollment.
Can you go over the levels like silver, gold, silver, platinum, and platinum plus on how long you have to be a participant in order to qualify for those levels?
Let's see here.
I can cover it, Dina.
Okay, thank you, Karina.
So under the Plan A silver participant is up to 42 months of employment. You become gold on your 43rd month. Then you become platinum on your 67th month. If you were hired after March of 04 and then prior to 07. If you were hired after July of 07, then you become platinum status at 79 months. And then Platinum Plus, that's everybody for the Plan A hired prior to March of 04. For the Plan B, that would be everybody hired prior to October of 2004.
Karina, on that, can you go over when a member would be, what level they would have to gain in order to select Kaiser?
Yes, so they would have to be at a platinum level. Again, if they were hired between 04 and 07, that would be 67 months for them. If they were hired after 07, that would be 79 months.
Okay. A member is asking, she has children enrolled and they're, the daughter is 22 years old and she has a job, but it is temporary. Can she still keep her on the plan right now as a dependent?
Yes, she would be able to keep her on the plan.
Under the active plan, you can keep eligible dependents up until the age of 26 without having to disclose their current work status, student status, or sorry, the office lights turned off on me here, student status or marital status. So you can cover that up until the age of 26.
Okay. Can you go over the paperwork that's needed to enroll a spouse and a child?
For a spouse, we would need the county recorded marriage certificate. And for any dependent children, we would need the county recorded birth certificate for each child.
Okay. There was one additional question that I think Steve answered for Steve about a dependent child that was in Arizona. So I think all the questions right now have been answered. Oh, is there vision insurance for the Anthem Plan A? Can somebody?
Yes, all medical plans offer vision benefits.
But that is not done through Anthem. It's done through the trust fund as an
Correct.
individual plan.
Correct.
Can I ask a question?
Yes.
So what happens when your child turns 26 My daughter's going to turn 26 next month. How do you get, can you explain the COBRA thing?
You should have received or will receive a COBRA packet that would show the overage dependent life event. And you can enroll in COBRA through that, through the information on the COBRA letter.
Do you know how long you have to decide?
Usually there's a 60-day enrollment period, and then the COBRA benefits would extend for 18 months.
Thank you.
You're welcome.
Another participant asked if they're happy with their Anthem PPO, their union dentist and optometrist, do they need to do anything?
No, you don't need to fill out any documents. I don't know if we mentioned it, but on your My Portal site, if you have any changes to your contact information, your address or phone number, you don't need to fill out an enrollment form, but you can actually update your contact information through your portal.
So if you would like everything to stay the same, there's no need to complete a form this year. It would roll right into 2022.
Okay. Another person asked, why do they have to wait to put their spouse on the plan? That one's interesting. That question, that these benefits, all these benefits that we negotiate are part of the negotiations. So every 3 to 4 years, when we meet with your employer to negotiate benefits, all these benefits are up for grabs. So obviously we want to always maintain what we have, gain additional benefits like we have with the rollovers in the recent years, gain options to add HMOs like we did recently on adding Anthem as an HMO earlier, and opening it up that after post 04. So all these benefits are negotiated. And it takes through unity us fighting to keep what we have and gain benefits. So the reason a spouse takes so long to be put on the plan, or courtesy clerks take 18 months, because these are negotiated benefits. And we encourage you to fill out questionnaires that each local will mail out, that we are looking for members' input on benefit changes and contract changes that you are interested in improving. And we encourage you to complete those so that the union negotiators who are on this call are aware of what the needs are of the members. Kathy, did I miss anything?
No, that was perfect. I would just say if you want better benefits, and this is same, better pay, better benefits, better working conditions, get involved in what's happening, because our contract expires March 6th, which is basically what, 3 months away. It's December 6th, so it's January, February, March. So we got 3 months until contract expiration, and that is the opportunity to make it better, to make the eligibility faster, to be able to add your spouse sooner, to any improvements that we want to make. We got 3 months to get ready. So get involved now, and talk to your coworkers about getting involved as well.
We have a final request for the link of the portal one more time. Can somebody share that on the screen and put it in chat? And the portal is the trust fund. It's this, somebody asked if it was different. The portal is direct access to your files with the trust fund. You can look at the plan on there that, I forgot, somebody went through it. That the portal gives you lots of useful information. So at midnight, if you're up and you need to look up who's on your plan, what providers are, all that, you can link into the portal. If you have Anthem, like Tyler said, you could link into Anthem or the micro site with Kaiser. So these things are accessible online throughout 24 hours a day. Somebody asked, do they need to set up an appointment at the office to speak with anybody? I think at our local office, you do not, at 1428, you do not have to set up appointment. Food Trust, do they need to set up appointment to see anybody there at this point?
We do have virtual and in-person by appointment only, but is also a curbside service that we provide. So they can just pull up right into a parking space, call the number, and somebody will come down to assist them.
Kathy, at your office?
So you don't need appointments. All the local 770 offices are open, available for walk-in appointments. We do have some security measures at all of our offices. You got to ring to get in just because we want to check to make sure people are wearing masks and that kind of thing. So, the procedure is a little different than pre-COVID, but you do not need an appointment. Anybody can walk in at any time that we're open.
Matt Bruno, would you like to comment on 1167?
Yes, you do not need an appointment at 1167. You can walk in and there'll be somebody to help you. Obviously, if you do make an appointment, it'd probably be much more expedited, but there is no appointment needed.
Well, thank you everyone for participating and asking the questions in chat. We do remind you that the deadline is December 31st, and it must be postmarked or delivered in our offices in order to be able to enroll. Kathy and I and Matt all sit on the appeals committee, and we have a lot of people that end up missing that deadline. There are several people on this call, but obviously it isn't all the participants. So we encourage everybody to share this information with your coworkers that it is open enrollment and have those discussions to remind people to enroll now and not lose that opportunity, because open enrollment only comes around once a year, and this is the time. Otherwise, unless you're newly eligible, open enrollment stays the same. The only time that is on special circumstances, and that is if you get married or your child is born, that you can add the dependents onto your plan at a outside of open enrollment, but it must be done, I believe, in 120 days.
That's correct, 120 days.
Or if somebody loses other coverage through an employer.
That's correct. So please share this information that you learned tonight with your coworkers. As you learned tonight, we have many resources. Please reach out to our Union Local Benefits Department staff or the trust fund directly. We're all happy and we're all here to help you succeed and get the benefits that we've negotiated for you. Don't rely on your manager, your STIR management team to give you these answers. They are not administrators to the trust fund. Please reach out to the experts that could help guide you, even when you do an address change, because there is a lot of mail that is returned to our benefits, the trust fund. If you move and you don't let us know, we can't communicate with you. So we encourage you to make sure that you update us on your address changes as they happen, or go into the portal, which makes it a lot easier and it updates immediately. Thank you all. Thank you for the trust fund staff for presenting. Thank you for the trustees, the union reps, the staffers. Diane, I see her. I see my Diane bobblehead. Philip, our union reps, Marvin, Catherine. I saw Deanne. We're all here for you and we're here to serve you. Thanks again and have a wonderful night.
Thank you.
Thank you, guys.
Thank
Thanks
you.
for inviting us. Take care.
Thank you. Take care. Have a good night.
Thank you.